Are you struggling to figure out what your heart risk is or how to measure your heart health? I want to share with you 6 preventive lab tests that you should ask your doctor about. Hi, my name is Dr. Stephanie Saucier, and I have treated thousands of patients with heart disease. And at this point in my career, these are the 6 lab tests that I test on every single patient to try to figure out what their cardiovascular risk is. So let's get into it. This is the newest test that people ignore, and that is your Lp(a) or lipoprotein A test. I measure an Lp(a) in every single patient because lipoprotein A is an independent atherogenic risk factor for developing premature heart disease, early onset strokes, aortic stenosis in the middle age, and overall can really affect your overall heart health and your prognosis when we're talking about atherosclerotic disease. So 1 in 5 patients are affected by having high lipoprotein A or Lp(a). And so because it's so prevalent, it's important that we're testing for this because those people who do have high Lp(a)s, we can then better risk stratify them and be more aggressive with their risk factor modification to prevent atherosclerotic cardiac disease. We know that there are no FDA-approved medications that directly lower Lp(a) just yet. However, there are medications that we can use to better modify your risk, like lowering your LDL if you're someone who has a high Lp(a). And medications are currently in phase 3 clinical trials for the treatment of Lp(a) as well. So why is no one talking about inflammation and heart disease? Well, that's why I recommend every single patient get a high sensitivity CRP tested. We know that inflammation ultimately is a risk factor for, and one of the early stages that leads to atherosclerosis and heart disease, including heart attacks and strokes. And so knowing what your body's inflammatory response and reaction is something that's going to be important. It measures the amount of basically the sticky particles or the atherogenic particles. Have you ever wondered what are the stickiest lipid particles in your body? Well, that's why I recommend the next test. ApoB measures the number of bad particles or atherogenic sticky particles that are going to be the root of creating atherosclerosis. So if you want to know how many bad particles you have, we test an ApoB. We can't talk about preventative heart testing without talking about a lipid panel. So a lipid panel is a fantastic baseline test that everyone should have. And it looks at your total cholesterol, your triglycerides, your HDL, your LDL. And the reason why we want to know all of these is because collectively, they give us a good assessment of your risk. Your triglycerides also give you a good assessment of your metabolic health and your insulin resistance. And we also will be able to identify people who have a form of familial or genetic hyperlipidemia with a standard lipid panel. Did you know that low vitamin D can actually lead to increased risk for side effects to medications that you may be prescribed? And that's one of the reasons why I measure vitamin D levels in all of my patients. Vitamin D is associated, if you have low vitamin D levels, it can be associated with elevated cholesterol levels. And as I mentioned, if you have low vitamin D levels, then you also have an increased risk of developing side effects to certain medications, such as statins, which we may want to use to help treat your hyperlipidemia. Now, this last one may be unexpected, but the last test that I recommend is actually checking your thyroid levels. And the reason why I recommend testing your thyroid function is because thyroid function can lead to a lot of, whether it be hypo or low thyroid function or high or hyperthyroid function, can lead to a lot of symptoms that you may feel from a cardiac standpoint, and also may lead to you having symptoms of high cholesterol that may be driven by your thyroid and not actually by your cholesterol at all. So in other words, sometimes if someone has hyperthyroidism, that it can actually drive palpitations or feeling of unease or some other cardiac symptoms. It also is possible if you have hypothyroidism to have slow heart rates, can also develop heart failure. And so knowing your thyroid function is really important because 1, it can lead to a lot of cardiac complications, and 2, some of the symptoms you may be presenting with might not be driven by the heart, but might be driven by the thyroid dysfunction. And fixing the thyroid dysfunction then eventually resolves those symptoms that you may be having. So there you have it. Those are the 6 lab tests that I like everyone to be tested for when we're talking about preventive heart disease and preventing heart disease. Please go out and ask your doctor if you can have these labs tested today. They're a simple blood test. And if you like to learn more, please check out my free heart health guide and subscribe to our channel. Thanks, and I'll see you in the next one.